We are happy that you are here. We have a jam-packed webinar, so I want to get going to make sure that we can get you all the information. And if I know some people were discussing some external meetings, feel free to do that in the chat. We're going to get going. Our agenda today is welcome, you guys. Share our announcements and resources. We have a good bit for you, and we are thrilled to have an update from our communicable disease unit, our immunization unit, the Greater Chicago Food Depository, and the Illinois Public Health Institute are going to give updates on healthy eating. Let's get going. Our objectives for our meeting are to stay informed, share resources, and provide community support to our school and like-minded community. Please mute your lines. We are recording this webinar, so if you missed it, it will be uploaded to our school health website as well as our YouTube page. A few announcements. All of the links for our upcoming webinars for the rest of the school year are on our website. You can scan the QR code to find that registration link there. And if you have not signed up for our school health newsletter that comes out monthly, the second QR code will get you the sign up for that. That way you're not missing any pertinent information. In recognizing February is Teen Dating Violence Month, the Crisis Center of South Suburbia will be here to discuss signs, symptoms, and ways you can assist someone in need. You can scan that QR code on the slide in order to register for our February meeting. CEUs to be mailed out. Thank you so much for your patience and your support. I know it's been a long, frustrating journey. It was sort of out of our hands as we were not the distributor, and they were had a staff shortage, an emergency staff shortage. So she's been working diligently. I just spoke to her yesterday. They're going to email those out. So thank you so much, and I apologize for the long delay. If you need to contact CCDPH for various reasons, any webinar related questions, you can email the Healthy Cook email address. If you'd like to report line lists, communicable disease, or you have any metrics questions, you can email that CCDPH_schools email address, or our general website, our school related website, and to request asthma and allergy resources. A little video, you see people doing their 2025 wrap to show you all the work that they've been doing. You see it on Spotify, you see it on other advertisers. So we have our CCDPH, who we are 2025, a quick 1-minute video. So this is just a little tidbit of all the hard work we've been doing in 2025. Be on the lookout because we want to continue our activities within the community and to continue to strengthen these supports that we have established throughout the community. For those who may have attended a data ambassador training that CCDPH held, it was open to community members who would like to know how to access data and use it in order to enhance their programs, whether it be for grant purposes or just in their work. The workshops were held previously. However, a toolkit has been developed in order to help you use that information. You can scan the QR code and it'll take you to that website. And then you can utilize the toolkit and any of that information. And there's also some contact information if you have further questions.
Okay.
The person who coordinated the ambassador workshop can answer any of your questions. Let me just mute this person 1 second. There we go. Let's continue. We have quite a few resources that we want to share. For those who are regulars to this meeting, you're aware that I'm no longer the contact person for allergy and asthma prescriptions, but you can request that using the information that is on the slide and it will get those resources to you. For schools who are automatically opted into the Rescue Illinois program, they should reach out to Rescue Illinois with any questions regarding those materials that they were sent via Rescue Illinois. If you would like to request naloxone, you can contact Denise Holman at CCDPH. And there's also a request form in order to request that material to be sent to you. Our nursing staff, if any of you are at our school health conference, you saw the mini presentation from our nursing staff. They have started back our hearing and vision screening program. It was defunct for a few years. So now we have two screeners who work county-wide. So we're starting out with ages 3 to 5, and we hope to increase those ages for schools who are requesting those screening services. So you can request that at that email address at the bottom of the slide. CCDPH has free flu and COVID COVID vaccination clinics. There are going until March, so the dates are on the flyers and it is open to all. In addition, Orland Park has now become a VFC or Vaccine for Children provider. They are now offering vaccinations to all in the Chicagoland. A representative will be here next month to provide more information, but the clinic dates are on the flyer and it's open to all. So please share that widely because they'd like to get that information out. In other vaccine news, this is the time of the year that organizations such as schools are requesting those mobile vaccination clinics or those health fairs in order to have vaccinations in attendance, and their calendar fills up fast, so you can request those programs that are on the flyer. We have a few mental health resources, and I'll sort of zip by in the interest of time, but we have some mental health resources that have been put on one slide for your ease, but also we have the individual flyers for 211, which is the nationwide helpline, 988, the suicide crisis line, and some information from NAMI. They have some back to school information, as well as they have started their family to family programs for families who are in crisis experience or experiencing any mental health challenges. They have one in Winnetka and one in Skokie. And also Metropolitan Family Services has a crisis line, in addition to the Lincoln Option Center, who was here last month to talk about their living room, their Quiet Storm living room, and their mobile crisis line that they have as well. In addition to Rincon has some mental health first aid, and Sertoma also offers mental health first aid classes. Maine Township provides free or low-cost counseling and other programming, so you can reach out to them if you are in that area or you know someone who could use this information. Lots of community resources, such as Illinois Doc Assist is a free statewide program for medical assistance, as well as Governor State is offering a free beginning ESL program. So if you have families who are maybe in need for ESL programs, Governor State University is offering these free classes. DCFS has a scholarship for current and former kids who have been in care, and the scholarship deadline is March 31st. You can scan the QR code for information. Early applications are suggested, as it takes a while to get that information from DCFS to the scholarship committee. More scholarships are available at some different organizations that we want to share. Make sure your students get all of this information. This is for the Coalition to End Homelessness, as well as this is a list of CEDA's community offerings. We hope to have representatives from CEDA here shortly, maybe in March, to talk about information that they have. A few pantries that are going on within the community: Maywood, South Suburban pantries. Blue Island has an upcoming pantry, and here's a list that has been congregated of all South Suburban pantries. You can scan the QR code to find that list. And also, we can't forget about our babies. Heinz VA is sponsoring a pet pantry. They had one yesterday and then another one next week. Aunt Martha's has a youth action board. If you know anybody who is interested in violence prevention or wants to be a part of a youth action board, as well as Varsity Tutors has low or no cost tutoring to different eligible school districts. A few community events for the upcoming holiday. I'll zip through them. I do want to highlight Congresswoman Robin Kelly puts on this large youth fair every year, and it has school information, trade information, summer job information. So please share this information for the upcoming fair that she has March 14th. She does this annually, and there's a large following of representatives there. And I'm going to zip through the upcoming events. Please feel free to look back at the events at when they are posted on our website. So I'd like to bring Candace, our immunization rep, to the stage, so to speak, so she could give you a few updates on immunization practices.
Hi, thanks, Kelly. Some of you know me, some of you may not. My name is Candace Nix. I'm the manager of the Community Immunization Program here at CCDPH. I just wanted to step in and briefly talk about some of the federal changes to the immunization schedule for children and our stance on how we will move forward and our recommendations here at CCDPH. Next slide, please. So some of you may have already heard, but the U.S. Department of Health and Human Services announced some pretty major updates to the childhood vaccine schedule. So essentially, reducing the recommended vaccines from 17 to 11 by removing these vaccines that are here. You'll see flu, COVID, hepatitis A and B, meningococcal, and rotavirus vaccines, and then move them to either a high risk category or that shared clinical decision making with their doctor's piece, meaning you need to make a decision with your doctor and kind of go through this rigmarole. So we all know that this puts children and the greater public at risk for more disease outbreaks, hospital stays, and even death. Next slide, please. And just really quickly, our stance here at CCDPH is that, the immunization schedule has been long developed using science and medical experts, and it's rigorous evaluation and safety and effectiveness. So we don't want to go around that. We want to continue to follow those guidelines. CCDPH doesn't agree with the federal recommendations, and we will be following IDPH's guidelines for science and evidence-based immunizations and administration schedules. I did put a link here for any additional information you'd like, including schedules on the IDPH website under immunizations. Really quickly, Kelly did a great job of highlighting some of the immunization resources that we currently have. We are hosting weekly Saturday clinics for flu and COVID specifically through the end of March at all of our ACHN clinics within the Chicago suburbs. We also are working directly with SIMPAR. So if you don't want to go through SIMPAR, you can certainly reach out to myself and I can coordinate if you'd like to host a flu or COVID clinic before the end of March, because they will be ending their flu and COVID kind of respiratory virus vaccinations at the end of March. And then you'll hear more about our back to school season that'll be coming up so we can get our kids prepared. I look forward to working with all of you, and please reach out with any questions. Kelly, thank you.
If there are any questions for Candace, please put them in the chat. Candace, if you could also add your contact information and possibly that link to the vaccines, to the immunization resources that you shared, that would be fantastic. I
I will
appreciate
do
it.
that now. Thanks, Kelly.
Thank you so much. And I would like to welcome Avi Joseph to talk about our communicable disease updates. Avi, I don't know if you wanted to control your screen or you wanted me to advance your slides.
Yeah, I think it's fine if you advance my slides. Thanks, Kelly.
No problem.
So yeah, I am Avi Joseph. I've been here a couple not times now. I work in our communicable disease unit, and I'm just going to be going through some communicable disease happenings in Cook County. You can go next slide too. So this is the landing page for our respiratory dashboard, which I think I've shouted out a few times. You can see that we are looking at this. This is as of last week, so I think yeah, we update every Friday, so definitely check back later today for when that gets updated. But as of last week, we're looking at high flu activity level and moderate COVID and RSV level. Very tragically, we did see our first pediatric flu death of the season this past week. Um, and COVID continues to elevate. It had changed from low to moderate, seeing increased wastewater detection. So yeah, lots of respiratory activity going around right now. Can you go to the next slide? So this is looking at percent of ED visits due to influenza. You can see that last year, that first graph on the left that's comparing this year to last year. Last year was already a pretty severe flu season, and you can see that we already topped the peak of it as of 2 weeks ago. And then that graph on the right is splitting it out by age group. And I believe that the blue is 0 to 4, and the orange is 5 to 17 year olds. So you can see that a lot of this ED activity due to flu is present in our school age children's and our little ones. You can go to the next slide. This is just looking at some of our outpatient lab data. So that top graph is looking at COVID-19 percent positivity at our outpatient labs. Um, we have kind of, surpassed the numbers that we were looking at the same time last year. So, like I said, kind of starting to see more COVID activity at this point in the season. And then that bottom graph is looking at influenza subtypes at our outpatient labs. Most flu specimens don't get fully subtyped, so I don't know if you can see that, but you'll see that that red bar represents flu A of unknown subtype. But as I've talked about before, and I'll get into later, this flu season is being primarily driven by the H3N2 subtype of flu A, whereas last season was H1N1, which could kind of explain why it's not common to have two back-to-back severe flu seasons, but because they're kind of two different subtypes are dominating the past 2 seasons, that's kind of what we're looking at. Gonna go to the next slide. This is looking at our wastewater data. You can see that we got pretty substantial increase in wastewater detections both for COVID and flu. I do want to note for COVID specifically that we see that very high mark, but there's been like a little bit of a what we call like a decoupling of wastewater results compared to severe illness. So, just to kind of take that with a grain of salt, that like just because if you see like a huge spike in wastewater detections, that doesn't necessarily mean that a whole lot of people are sick with COVID. I think there's a lot that we just don't know about wastewater science, and it's something that we're continuing to explore. You can go to the next slide. This is looking at the percent of inpatient admissions due to flu by age, which is the top graph, and race, which is the bottom. Again, you can see looking at that top um, that top graph that again 5 to 17 year olds really that's explaining flu is explaining a lot of their inpatient admissions. And yeah, looking at that bottom graph, you can see that non-Hispanic Asian that category is also quite high as well. Um, I saw a comment in the chat about even mild COVID cases can lead to long COVID. Yeah, definitely. That's certainly why, in any instance we can, that we want to prevent transmission and infections, even if on the surface the infection seems mild. Can you go to the next slide. And this is looking at our ICU admissions due to COVID, comparing last year to this year. This year still haven't seen too much severity in terms of ICU admissions compared to last year, and despite that, big wastewater increase. So, knock on wood, it's hopefully looking like this COVID season will be less severe than what we had before. You can go to the next slide. And then now we're just talking about kind of non-respiratory things in general. So I had mentioned that the flu A H3N2 is kind of what's dominating this season. So there's actually this new subclade of H3N2. You may have heard in the media about the super flu. I don't I don't tend to like when the media gives viruses names that make it sound like a supervillain, so I'm gonna call it Subclade K. But if you've heard of this super flu, that's what they're talking about. So this emerged in the Southern Hemisphere during their 2025 flu season. It really prolonged the length of it, and it actually caused the most reported flu cases in Australia since they've been recording that data. Just kind of looking at the genome of this flu virus compared to the one that's in the vaccine, it shows that there's this significant divergence of subclade K from the strain that was selected for this year's vaccine. Um, and like I said, even though last flu season was quite severe, we did actually see the most pediatric deaths since 2004. It was dominated by H1N1 and not H3N2, meaning that there may not be quite as much population level immunity as there normally would have been. Um, and then just looking at there has been some kind of preliminary vaccine effectiveness studies, particularly out of Europe. And it does still appear that the vaccine is extremely effective at preventing ED and hospital admissions in children, looking at about a 72 to 75% reduction in risk. And, just kind of going back to that, first chart that I showed you that, children are kind of being disproportionately impacted by this flu strain, and they kind of get the most benefit from getting it. So definitely still want to encourage flu vaccinations wherever we can. You can go to the next slide. Um, Candace did a really great job kind of like setting me up for this just with the information about the changes to the vaccine schedule, kind of based on the actions taken by the federal government. And I think there's this perception that, I don't know, that vaccines are bad or that there's, a lot of negative vaccine press, that kind of thing. But I read this interesting article that kind of makes the case that we're currently in the golden age of vaccine development. There's been substantial advances in a number of scientific fields, biology, genomics, microscopy, immunology, that have kind of taken us from, these like really uncertain, imprecise, just kind of looking at the history of vaccines. The first vaccine was, the smallpox vaccine. That was very, unintentional. And then, it was just kind of involved transferring basically cowpox, which was a similar virus to smallpox, just kind of transferring it among people. Not sure if there's somebody who's on mute or who could maybe unmute.
Got it. Thanks.
Okay, thanks. Yeah, so just the kind of advances that we've made have basically led to us being able to identify, antigens to the atomic level and really precisely craft vaccines around that. Just in the last 5 years, we've developed effective vaccines against COVID, malaria, RSV, chikungunya. Malaria and chikungunya, they're not things that we think about too much in the US, but they're truly devastating illnesses in the developing world. So incredibly impactful scientific developments. And so, yeah, just I feel in the sphere of public health, we kind of tend to be reactive when it comes to defending vaccines. But I just kind of wanted to make this proactive argument that like, despite what you might be hearing or despite what the perception is, we are really in the golden age of vaccine development and administration. It's never been easier, faster, or safer. You can go to the next slide. And then, like Candace had mentioned, one of the vaccines that was removed from the universal childhood schedule was the rotavirus disease or rotavirus vaccine. So rotavirus is a viral illness that infects the lining of the intestines, kind of your standard stomach flu, high fever, lots of nausea, vomiting, diarrhea. It can certainly be very severe in young children who can become, very dehydrated. Prior to the universal recommendation of a vaccine, rotavirus caused 2.7 million cases, 500,000 doctor visits, 55 to 70,000 hospitalizations, and 20 to 60 deaths in the US each year. So in 1998, the first rotavirus vaccine was rolled out. And then reports started coming into the vaccine adverse event reporting system, or VAERS, of this intestinal blockage that was occurring after vaccinations. So public health investigators, just looked at the data kind of and making a comparison between those who were vaccinated and those who weren't, saw that there was a higher risk of blockage in infants who had received the vaccine. Um, so the reason I'm mentioning this is that it's kind of to me shows that it's proof that that the system works. There was only an incidence of 1 in 20,000 doses causing this, but just that even that like very, very light signal can be identified by public health investigators, and the vaccine was pulled immediately. And then if you go to the next slide. So, the rotavirus vaccine was essentially improved over the next decade, and two new ones were rolled out in 2006 and 2008. While that intestinal blockage can still occur, it's much rarer, and it's actually basically they kind of made the comparison to like how much intestinal blockage occurs due to rotavirus infection, and realized that the vaccine is kind of like much safer even in terms of just the intestinal blockage, let alone the preventing the risk of illness. That vaccine is given at 2, 4, and 6 months, and if you can look at that chart on the right, and see that since the introduction and universal recommendation of the rotavirus vaccine, hospitalizations due to rotavirus have plummeted 80% since 2006. So, rotavirus is not necessarily something that you think of when you think of vaccine preventable diseases. But yeah, certainly a pretty substantial scientific development, both here and particularly in the developing world. Um, I think that's everything I had. You can go to the next slide. That's my contact information. We have a weekly respiratory report that kind of summarizes what's going on from our respiratory dashboard. If you want access to that report, you can email my colleague Courtney, and I'll be sure to put some of these links and contact information in the chat as well. Happy to take questions, but if there's nothing, I will pass it back to Kelly.
Thanks, Avi. Great information. And I see that Joy said even mild COVID can cause long COVID. It's a scary disease, and you don't know how it's going to affect you. Thank you so much for that information. I would like to welcome Tyler Stratton from the Greater Chicago Food Depository to talk to us about changes in SNAP. Hi, Tyler.
Everyone. Thanks so much for having me. Good afternoon and happy Friday. My name again is Tyler Stratton. I am Director of Community Engagement at the Greater Chicago Food Depository, here to share a little bit about the pending changes to the SNAP program. Next slide, please. Before we jump in, I will share a little bit about our organization. The Greater Chicago Food Depository is the food bank that services Cook County, and our mission is to end hunger. To achieve the mission that you see here on the slide, we work in partnership with 800 plus partners and programs all across the county to provide emergency food access, to connect neighbors to public benefits like SNAP, and to lift our voices to address the root causes of hunger. Next slide. To set the stage for what we'll be reviewing today regarding SNAP, it's important to know that 1 in every 5 households in the Chicagoland area experiences food insecurity. And when a household also has a child in the home, we are now looking at 1 in 4, or about 25%, again, of households with children in the Cook County area experiencing food insecurity. Currently, the Food Depository and our partner network serves just around 175,000 households every single month. And so overall, we know that demand for food assistance is really high in our community across the board. Next slide. And so one of the programs that can help address this high need is SNAP. As folks may know, SNAP, or the Supplemental Nutrition Assistance Program, is a government program that puts money in the pockets of individuals and families to purchase the food that they want and need. Many in the community may know the program as LINK or as food stamps. And the program is regulated at the federal level by the USDA, and here in Illinois, it is administered, again, at the state level by IDHS. In the next couple slides, I'll talk a little bit more about why SNAP is so important, but also to share more about the upcoming changes. But one thing that we really want to drive home today in this space, but also as we connect with community members and SNAP recipients, is that even though we are experiencing these threats to the program, SNAP benefits are still available, and the program still remains a really vital resource to millions of families across the state and across the country. And so as you see here, we can keep on this slide for just a moment. I want to highlight a little bit more about why SNAP matters in addition to, again, putting food on the table. As I mentioned previously, the food depository serves about 175,000 households every single month through our food access programs. Even with all of the food that we distribute, the millions of pounds of food that we distribute as a food bank, SNAP still distributes 9 times as much food by putting money, again, directly into the pockets and hands of community members. So once again, for every one meal that a food bank like the Food Depository provides, SNAP provides 9 meals. And so this is a huge resource that, again, services just about 2 million people here in Illinois. Additionally, SNAP is really important for boosting the economy. As you think about people spending their SNAP dollars at the grocery store, the corner store, farmer's market, and those dollars then trickling down to support jobs or just support, a number of industries like agriculture and farming. SNAP, again, is really important. And so for some context, here in Cook County, SNAP generates about $280 million each month in local economic activity. And so, again, it truly is an economic engine. Next slide. And so that was a little bit about why the SNAP program is so important, especially in communities like Cook County where food insecurity is particularly high. Unfortunately, back in July of 2025, what is known as the One Big Beautiful Bill Act was passed by Congress. And this bill has resulted in the largest cuts to the SNAP program in history, just about $200 billion over the next 10 years. And we know, of course, this will have a major impact on anyone that uses the program currently, but also people who may need it in the future, as well as, again, our local economy. Next slide. And so the slide you see here on the screen is really a summary of the changes to SNAP and the impact, potential impacts here in Illinois. For the sake of time, we are going to, I'll highlight all of them, but we are going to dive into just 2 of these changes a little bit more deeply in just a moment. But as a quick summary, some of the changes include, first, the federal government is forcing states to shoulder an unrealistic amount of SNAP costs to keep the program running and operating, including here in Illinois. Second, the amount of SNAP benefits also will no longer be responsive to economic conditions as a result of the signing of this bill. The work requirements will become a standard part of how SNAP operates, and this is one that we will definitely click into in just a second. And then additionally, there is access to SNAP taken away from certain legally present immigrants. And then lastly, but certainly not least, the SNAP nutrition education component of the program has also been eliminated as a part of, again, the broader SNAP operation. So those are some of the highlights. Again, we're going to click into the work requirements and the immigrant eligibility in just a moment. And so the first key change to be aware of, as I mentioned, is the expansion of work requirements. This expanded rule states that individuals who are between the ages of 18 and 64, unless exempt, must work or volunteer 80 hours a month in order to keep their SNAP benefits. This can be a combination of work, volunteering in community service, or a SNAP employment and training program. Additionally, the new bill puts a time limit in place for individuals that are required to meet this work requirement but do not. And so starting February 1st, in just about 2 weeks, if a person does not meet these work requirements, they can only receive SNAP benefits for up to 3 months within a 3-year period. After the 3 months, the individual may lose their SNAP benefits and will have to reapply for benefits once they are either working or volunteering for 80 hours a month, or unless they are approved for an exemption. And so, again, this goes into effect on February 1st. And so there are 300,000+ neighbors here in Illinois who, if they are not aware of this change, if they are not, reporting accurately to the state, for February, March, and April, come May 1st, there is a chunk of people who are at risk of losing their SNAP benefits completely come May 1st, unless they take some sort of action. And so I'll talk about what some of those action steps can look like later on in the presentation. Next slide, please. As I highlighted, there are some groups that are exempt from this work reporting requirement. And so on the screen here, you will see some of these exemptions listed. For example, individuals that have a physical or mental limitation that bars them from working, pregnant individuals, et cetera. So you'll see a list here. Overall, this work reporting requirement is really, really important for folks to be aware of. It is new for the state. It is, of course, new for SNAP recipients. And so we're really trying to spread the word about this expanded rule, especially as we get closer and closer to that February 1st date. For lack of a better term, the clock essentially starts again on February 1st, where people will start to get dinged again, for lack of a better term, if they're not meeting these work requirements. And so again, as a result, we at the Food Depository are highly recommending that people who are receiving SNAP currently get in touch with the state agency now. There is a 2-page exemption form that people can begin completing and submitting to the state agency. And I'll link to that later on in the presentation as well. Next slide. The last change that I want to highlight is that the bill further restricts eligibility for immigrants with legal status. There are now certain categories of legally present immigrants who are no longer eligible for SNAP benefits in Illinois, starting as early as April 1st of this year. And so in Illinois, this means about 16,000 immigrants will lose access to SNAP benefits. These are individuals who were previously eligible for the program, but come April 1st will no longer be eligible, unfortunately. In some cases, you'll see the couple asterisks here on the slide. There may be state-funded food assistance available outside of the SNAP program. And so we encourage any neighbors, community members who may be impacted by this particular change to work with a benefit enrollment specialist, whether it be at the Food Depository or otherwise, to determine if there are other options available. Awesome. So I want to just, first of all, acknowledge that this is a lot of information to digest. And so I do want to share some additional resources next about where people can get more details, where people can get direct support or one-on-one support, as well as some action steps that we can all take to meet this moment. So first, for anyone who is receiving SNAP benefits currently, it is, number one, incredibly important for people to report changes as they occur. If income changes or household size, et cetera, it's important that SNAP recipients get in contact with the state agency sooner than later to share those changes. This level of accuracy is really key in light of some of the changes that I just shared in the past couple of slides. It's also for folks to understand what the work requirement is, if they need to meet it, and if they may qualify for an exemption. And so I'll hit that on the next slide. And then lastly, sharing this information far and wide is key, whether it's sharing it with a family member or a friend, or bringing a presentation like this to a different community space. That is incredibly important in this moment. In addition, equally as important is seeking additional support. This information can be dense and complex. And so there is a link to a website as well as a QR code where people can get started with our team, our benefits enrollment team, to get additional support as needed. I wanted to share a couple of action steps around the work requirements specifically, as well as the exemptions. First, on that first QR code that you'll see on the screen, there is a really user-friendly work requirement screener on the IDHS website. It just asks a couple of questions and essentially will give a recommendation or an alert to a community member of whether or not they might need to meet work requirements or if they may be eligible for an exemption, and then also links to some of those forms that I mentioned. And so we're recommending that neighbors use the screener to determine what their next steps may need to be as soon as possible, and of course, ideally before the end of the month. The form that I mentioned, I can share that after the presentation as well, or drop it in the chat. It's a pretty simple 2-page form that just requires kind of checking off any potential exemptions, but also that needs to be submitted to the state agency. And so folks, of course, can do that via the ABE Manage My Case portal or by contacting IDHS via phone or visiting one of the local offices. And again, should be done ideally before the end of the month in the best case scenario. I also wanted to share a couple of other opportunities to take action. And this is for anyone in the room who, whether you are receiving SNAP benefits or not. First and foremost is to help us spread the word. The very first QR code that you see here is a SNAP Changes Toolkit that has social media graphics or information that you can put in a newsletter or even a simple PowerPoint slide. I will drop the toolkit in the chat once I wrap up, but helping us to spread the word is really important. Additionally, as I alluded to earlier, we are happy to bring a similar presentation as the one we're doing here out to the community. And so if you are wanting to bring this information directly to your families or a different community space, the Food Depository is happy to show up to facilitate those conversations and presentations and can offer on-site enrollment as well. The Food Depository and our benefits enrollment team is also sharing just general SNAP promotional materials, and again, can show up on site to community locations to enroll people in SNAP or help with answering case-by-case questions. And then lastly, we have a number of opportunities in the advocacy space. It's really important that we all come together to lift our voice to protect SNAP in this moment. And so you'll see a couple of opportunities here, joining our Advocacy Action Center, participating in a storytelling campaign, or even participating and enrolling in our Champion Advocates community education program. Lastly, we have a number of other resources and tools that can support SNAP recipients during this time, including our Find Food Map, our Neighbor Service Support Team, as well as some nutrition education resources. All of these and more can be accessed on our website, chicagosfoodbank.org, or by giving us a call at 773-24/7-FOOD. That is all I have for today. Thank you all so much for having me. I'll drop a couple of items in the chat, but feel free to take down my contact information. If you have any questions, feel free to reach out directly, or if you're interested in collaborating further. Thank you all again.
Thank you, Tyler. This was great information. I'm sure it's a very confusing time, so this will be helpful to pass along to our families and our community members in need. Tyler's information is on the screen. I'll give you guys a couple minutes to take a picture of that slide. As I stated earlier, all of these slides will be uploaded to our website early next week so that you could use the information when you need to refer back. And I would like to welcome lastly Catherine Bernstein from the Illinois Public Health Institute. And Catherine is going to talk to us about making school meals an Illinois reality. Welcome, Catherine.
Thank you so much, and thank you to all of you for having me this Friday afternoon. Tyler, for your very important and timely presentation. I know we don't have a whole lot of time, so I'm going to try and move through this, and I'm glad that we're sharing out the slides too after this call. So thanks for doing that.
Don't rush yourself. If we go over a few minutes, it's perfectly okay. Don't rush yourself.
Thanks for that. So my name's Catherine Bernstein. I use she, her pronouns. I'm a program director working on food systems and nutrition policy with the Illinois Public Health Institute. And I'm excited to be here with you all today to share about the Healthy School Meals for All campaign, which seeks to enable any Illinois school to provide free meals to all of their students. So first, I mentioned I'm with the Illinois Public Health Institute. For those of you who may not be familiar with us, we're a statewide nonprofit whose mission is to advance health justice through equitable policy, systems, and institutional change. The Illinois Public Health Institute convenes a statewide coalition of partners who are interested in nourishing food and physical activity access, called the Illinois Alliance to Promote Opportunities for Health, or IAPO for short. IAPO's vision is an Illinois in which our collective efforts, representative of our diversity and all cultures, lead to policies, systems, and practices that enable all residents and communities equitable access to nourishing food, opportunities to engage in safe and enjoyable physical activity, and are supported to maintain their optimal health and well-being. We welcome any members at any time to join IAPO, and IAPO is the coalition that houses the Healthy School Meals for All campaign that I'll be sharing about. So before we dig in, I would love to share a quick video, if we're able, if tech allows, that talks about the campaign. This was produced by our partners at the American Heart Association. So Kelly, do you know if we'll be able to play it?
Yes, I tested it. We're good.
Incredible. Thank you.
No problem. Here we go.
Thanks for that, Kelly. I think that video does a better job than I could of introducing what we're trying to do. So first is a little bit of grounding. I imagine this is preaching to the choir given the focus of this group, but just wanted to make sure we're all on the same page. This is a bit of background information about the value and importance of school meals. So we know school meals are nourishing. And when they are free, they have been shown to improve students' health, their growth, their development, their mental health, and their academic performance. Horribly, we know that there is an access gap here in Illinois. Tyler spoke to this as well. We have over 400,000 children in Illinois experiencing food insecurity, and 1 in 3 of them were not eligible for free or reduced price meals due to outdated eligibility guidelines. And free school meals for all supports equity and reduces stigma. So on the next slide, a little bit of additional background. School meals are an incredibly important for nutrition security of Illinois children, and for far too many families, school meals may be the main source of a student's daily nourishment. Back in when we were in the midst of the COVID-19 pandemic, many of you may remember that there was a waiver in place that enabled all schools to provide free meals to all of their students. Unfortunately, that waiver expired back in June of 2022, which meant many families had to go back to paying for those meals, even though we know financial situations, budgets may not have improved since then, and schools have also had to return to collecting eligibility information and payment from some families. That loss of the waiver put thousands of Illinois children at risk for not having enough food to live a healthy and active life and to thrive in school. So on the next slide, this shows that Illinois does actually contribute to the cost of school meals. It's not all on the federal government and locals, but unfortunately the funding that Illinois dedicates to school meals has been drastically cut over the last decade plus from 26.3 million back in 2012 down to 9 million today. 9 million is the absolute bare minimum maintenance of effort level required of the state to participate in the school meals program at all. And it's meant that schools are not getting the 15 cents per free meal reimbursement rate that they've been promised through long-standing previous Illinois statute. So there is a lot more support that we can and should be providing as a state. On the next slide, I just want to touch very briefly about the community eligibility provision. It's what the law is built on. Imagine many of you are from schools that participate, so would love to hear any insights you have in the chat. But for those who may not be familiar, the community eligibility provision is a federal program that allows schools to offer breakfast and lunch to all of their students for free. So participating in CEP eliminates unpaid meal charges, minimizes stigma, reduces paperwork, and streamlines meal services. And again, if those of you, anyone on the line is at a school that's participating, would love to hear any benefits that I did not mention that you see from this program. The threshold for eligibility for schools or districts or groups of schools to opt in to the community eligibility provision changed from 40% of students coming from families that are identified as low income down to 25% in 2023. Schools that have a higher identified student percentage or more of their students from families with low incomes receive more reimbursement from the federal government for the free meals that they're providing. Schools that have a lower percentage or less than 62.5%, if we want to get technical, of students that are coming from those families with lower incomes usually have a funding gap that they need to make up with underfunding sources. So this effort builds on CEP to fill that funding gap to make it financially possible for schools to opt in to the program and provide free school meals to all of their students. So on the next slide, thank you. This just, I think, helps put a finer point on the importance of school meals. This is from testimony that a retired superintendent, associate superintendent of East Moline School District 37, Sherry Peacock, gave testimony at a committee hearing, sharing about their school district before they were able to offer free school meals to all kids through CEP. So just briefly, Sherry talked about having seen students arriving to school hungry. Teachers in her school district had cupboards that they were filling in their own classrooms with their own funding with snacks to help those kids out. There were notes going home with children about how much they owed for the food that they were getting from school and how they might be identified in the lunch line, and a note about watching a student open a lunchbox to only find a bag of crushed potato chips for their lunch. On the next slide is a quote from that same associate superintendent about what happened with her district after schools they were able to opt into CEP. So it says, my district didn't used to provide free meals to all students, and we saw kids arriving to school hungry with no breakfast and teachers spending out of pocket. Now that they've been able to participate in the program that allows them to provide free meals, they've seen a big impact on their students and families, allowing working parents to stretch their dollar further. Teachers spend more time teaching, and kids not worried about what their friends will think if they take a free meal. I'm so happy all districts in Illinois will now have the chance to get the resources they need to offer this program to their families, speaking about this effort. So transitioning to the campaign, I put the URL to our website on the slide. Happy to share that in the chat as well once I'm done speaking. On the next slide, just want to note Illinois is not alone in this effort. As you can see on this map, there's 9 other states, including our close neighbors in Michigan and Minnesota, that have their own healthy school meals for all programs. And all these states you're seeing in yellow have active campaigns just like us. So on the next slide, through our campaign, Illinois did take the huge, important next step of making school meals in Illinois reality by passing a law back in 2023 that does set up the framework for this program. So we do have a passed and signed law that we're building on. But unfortunately, that law is subject to appropriation, which means it only goes into effect if lawmakers dedicate enough funding in the budget for it. So our campaign on the next slide is asking for 67 million this year from the Illinois State Legislature to get the free school meals program started in the state. That would be enough to cover at least every school that has at least 40% of their students as identified as low income, probably more depending on uptake among eligible schools. So it would cover that funding gap that CEP creates that we talked about earlier. It's important to know that for schools that do participate, this would reimburse any meal that the child takes at the federal free rate. So parents, of course, could still send their children with meals and the state wouldn't pay for those. And it would also help make financial space for schools to focus on providing high quality, culturally responsive, and locally procured food in their meals. So would love for you all to join us. It's a significant budget ask, especially with all the budget pressures that the state is facing, and we absolutely cannot do it alone. So on the next slide, you can see all the organizations involved in our coalition working towards this together. We have folks representing schools, health groups, hunger prevention groups, local food, and more. We'd love to add any of you, your districts, other organizations to our effort. So if you are interested, please feel free to put your information in the chat. You can reach out to me directly to learn more and join us. Would be very interested in getting you connected, however makes sense. One piece that we do really need help with is sharing stories with lawmakers, with the media about the importance of funding universal free school meals. So if anyone's interested in helping us find families, school personnel that might be wanting to talk to their lawmakers or the media, we would love to get connected with them or with you. So my email is on the slide, as is my phone number, and again can share those in the chat, and they'll be in the slides once they are shared out. I just want to mention in our last minute, these next 3 slides have key lawmakers that are in y'all's area that are going to be very important to making this a reality. So if anyone on the line is familiar with these legislators, if these are your legislators, would really be helpful to reach out to them and let them know that you're in support of appropriating funds to make free school meals a reality for students in their district. I can also help share more tailored information about what funding this law would mean for the schools in these lawmakers' districts. So again, would just encourage anyone who's interested to get in touch and we can help make those connections. So I'll stop there. I know right at 3. Happy to hang on to answer any questions, or Kelly, if you want to send anything my way after the call, I can answer that way as well. But thank you all so much for your time and listening on this Friday afternoon.
Thank you so much. That was very informative, and I'm sure everyone will be happy to support any way they can, reach out to those legislators, keep them on the phone, make sure you let them know you're interested. It sounds fantastic. And thank you for all the work that you are doing. If there are any questions for Catherine, or if Tyler's still on the line, any questions, feel free to ask them now. Thank you for sharing that website, Catherine. And just any questions for any of our presenters, this is the time to ask now. Just to reiterate that next month is Teen Dating Violence Month. So we will have Crisis Center for South Suburbia here to talk about signs and symptoms and how you could support someone who is involved in a teen dating violence situation. You can scan the QR code in order to register for our meeting next month. And also, just to reiterate, our top QR code will take you to our website where you can register for the rest of the school year's webinars. They are individual registrations. I know I've spoiled you all with recurring registrations. We're trying to get back to that. Please be patient. And below is the QR code to sign up for our newsletter that comes out every month so you don't miss any information or resources. And as previously asked, all of our slides, recordings will be uploaded to our website next week so you can refer back to any information that you may need. In the meantime, thank you all for joining. We appreciate your support. Stay warm in celebration for our team this weekend. Good, better, best. Never let it rest. Go Bears. Have a good weekend. Enjoy your holiday and take care.
Thanks, Kelly.
Thank you all.